Hey everyone, welcome back to another High Yield Explainer. If you're gearing up for your board exams, you've landed in the exact right spot. Today, we're tearing down the complexities of viral gastroenteritis. We're going to lock in those absolutely crucial clinical distinctions and make sure you have the exact framework you need to completely dominate your exams. Let's get right into it.
Here's our game plan for today. We're going to meet the main viral culprits, break down norovirus, the outbreak king, and rotavirus, the pediatric threat. Then we'll put them head to head, and finally, we'll master those tricky exam traps. Let's go.
All right, Section 1, meet the viral culprits.
Before we get into the molecular weeds, we've got to talk about what's actually at stake here. Viral gastroenteritis isn't just some clinical nuisance. Roughly 500,000, that is the tragic number of kids, mostly under 5, who die globally every single year just from rotavirus. This hits especially hard in developing regions like sub-Saharan Africa and South Asia. So mastering these pathogens, it's not just about passing a test, it's about understanding a massive leading cause of severe and fatal diarrheal disease worldwide.
Okay, moving into Section 2, norovirus, also known as the outbreak king.
So if you see a question about an epidemic on a cruise ship or ripping through a tight-knit community, norovirus is your prime suspect for sure. Let's lock in the foundational virology. It belongs to the Calyciviridae family. It rocks a single-stranded, positive-sense RNA genome, and it doesn't have an envelope. But why is it the outbreak king? Well, it takes a tiny, really very low, inoculum to cause an infection, and it spreads highly efficiently through the fecal-oral route, but also, critically, through vomitus. We're talking aerosolized particles from throwing up and contaminated fomites. It's incredibly contagious.
Okay, let's dive into this. How does norovirus actually pull this off? It hijacks these things called histoblood group antigens, or HBGAs, which sit right there on your gastroduodenal epithelium. Think of them as the essential landing pads or ligands for the virus. Now here's a highly testable fact. People who lack the secretor phenotype literally don't express these specific antigens in their gut, and because of that, they actually get a relative resistance to norovirus infection. Pretty wild, right?
Now for the boards, you absolutely have to know the histopathology. Norovirus specifically targets the upper jejunum. You're going to see villus blunting and crypt hyperplasia there. And catch this, it causes a delay in gastric motor function. That's what drives that super prominent vomiting. But here's the kicker, there is zero adenylyte cyclase activation. None. The boards love to test this to make sure you aren't confusing its mechanism with bacterial toxins like cholera.
All right, Section 3, rotavirus, the pediatric threat.
While norovirus is out there driving adult outbreaks, rotavirus is the heavyweight champion of severe, life-threatening diarrhea in really young kids. Let's contrast the virology. Rotavirus comes from the Rheoviridae family. Now, instead of single-stranded RNA, it has a double-stranded RNA genome, and crucially, it's segmented into 11 distinct pieces. It's all packed into a non-enveloped, triple-layered icosahedral capsid. That segmented genome, huge buzzword. Just like influenza, those segments allow for genetic reassortment, which, as we'll see, has been an absolute game-changer for vaccine development.
So how does this structure actually help us classify the virus? It's all about specific structural proteins. You've got VP6 sitting in the middle layer of the capsid. That determines the group, from A to G, with humans primarily getting hit by group A. Then you have the outer proteins, VP7, which is the G protein, and VP4, the P protein. Together, they determine the serotype. This sets up a binary classification system, and both of these outer proteins are absolutely vital because they're the ones that induce neutralizing antibodies.
But how does rotavirus actually cause diarrhea? Enter NSP4. This is a non-structural protein, but it acts directly as an enterotoxin. It goes in and literally destroys mature enterocytes in the villus epithelium of the proximal small intestine. When you lose that absorptive surface, it leads straight to the massive, watery secretory diarrhea that makes this bug so incredibly dangerous for infants. Burn this into your memory. NSP4 destroying mature enterocytes is exceptionally high yield.
But hey, fortunately, we have vaccines. Remember that genetic reassortment we just talked about? That exact mechanism gave us Rotatech, which is a pentavalent live oral vaccine made from bovine human reassortants. We also have Rotarix, a monovalent live oral vaccine. Both are fantastic, but you need to know this clinical discrepancy. They hit 85 to 98% efficacy in industrialized countries, but only about 50 to 65% in developing nations. It's a phenomenon that's actually very similar to what we see with the oral polio vaccine.
Section 4. Noro versus Rota, the key clinical distinctions. Now, what's really interesting about this slide is how perfectly it sets you up to nail a clinical vignette. Let's bring them head to head. Notice how the clinical timelines completely diverge. Over on the left, norovirus, it's fast and sharp. The illness lasts just 12 to 60 hours, it's self-limited, it hits people of all ages, and the vomiting is incredibly prominent, especially in kids. On the right, rotavirus. This one's a longer battle, lasting 3 to 7 days. The vomiting usually starts before the watery diarrhea kicks in, it peaks specifically in babies aged 4 to 23 months, and severe dehydration, that is your absolute major clinical concern.
And this right here perfectly frames your ultimate differential diagnosis. Look at the nucleic acid row. We've got norovirus as positive single-stranded RNA. Rotavirus has double-stranded RNA with those 11 segments. And just to round out the enteric viral landscape, enteric adenovirus 40 and 41 is double-stranded DNA. But check out that bottom row. Despite all their massive differences in genome and family, every single one of these major viral gastroenteritis agents is non-enveloped. That's a great unified fact to just memorize right now.
All right, final stretch. Section 5, Mastering the Exam Traps.
This is where we separate the novices from the board-certified pros. Let's do a really quick nod to some minor agents that love to show up as distractors. We just mentioned enteric adenovirus types 40 and 41. Unlike the adenoviruses that give you respiratory issues, these specifically cause diarrhea. They are double-stranded DNA, and importantly for the lab, they are notoriously tricky to cultivate. Then there's astrovirus, a positive single-stranded RNA virus that generally just causes pretty mild to moderate pediatric diarrhea.
Okay, take a breath. You've got the virology, the clinical presentation, and the vaccines. But are you ready for the ultimate board exam traps? These are the exact specific facts examiners use to trip you up. Pay close attention here.
Here is your rapid-fire synthesis so you don't fall for them. Trap number 1. If they ask about a withdrawn vaccine, they're talking about Rotashield from back in 1998, which got pulled due to a risk of intussusception. Trap 2. Norovirus immunity is notoriously short-lived. Actually, there's this weird paradox where having high pre-existing antibodies to the norovirus strain can make you more susceptible. It ties right back to that HBGA phenotype dependence. And the absolute biggest clinical trap of all, the treatment for viral gastroenteritis is supportive oral rehydration. No antibiotics, no antimotility agents on a viral vignette, ever. Don't let them trick you.
So we've seen how understanding the segmented genome of rotavirus allowed us to drastically reduce childhood mortality through vaccines. But the outbreak king still reigns without a licensed vaccine. With clinical trials happening right now, you really have to wonder, will modern virology soon conquer norovirus once and for all? Thank you so much for joining me on this explainer, guys. Keep these frameworks locked in for your exams, and as always, keep learning.